You probably think about your gut health, right?
Hmm.
Maybe even your brain health. But what about your mouth? What if we told you your oral health isn't just about, a bright smile, that it's actually a critical player in your overall systemic health, impacting everything from your gut to your brain? Okay, let's unpack this.
Yeah, it's a truly intricate system, far more connected than many of us realize, I think. Today, we're taking a deep dive into this fascinating world of the oral gut-brain axis. And our insights are coming from a really comprehensive review published in Nutrients just this year, 2024. It's called Balancing the Oral Gut-Brain Axis with Diet.
Right. And our mission here is to sort of pull out the most important nuggets of knowledge from this research, give you a shortcut to understanding this vital link. You'll discover some surprising facts and actionable insights, things you can actually use. So what does this all really mean for you?
Well, maybe let's start with biological aging. It's a good place to begin. This isn't just your chronological age, how many birthdays you've had. It's more about the progressive decline in how well your organs function, how different systems in your body communicate with each other. And what's really fascinating is that this process, it varies hugely between people, independent of their actual age. And a key player, your gut microbiota.
Right, the gut microbiome. We hear so much about it, and it influences so many basic bodily functions. We're talking like how your body handles glucose, your movement, sleep patterns, even eating behavior, anxiety levels, immune responses. It's huge. And as we get older, we often see this drop in the diversity of the good microbes in the gut, which, well, isn't great news.
Exactly. Now, let's pivot a bit to your mouth. When we talk about microbial communities in the body, the mouth actually harbors the second largest. Think of it like a bustling city inside your mouth. You've got different neighborhoods, the cheeks, lips, teeth, tongue, the gums. Each spot fosters its own unique mix of microbial species.
Okay. So you'd think mouth and gut, they're connected, right? The microbes must be similar. But they're actually pretty distinct. Your body has these amazing defenses, like the strong acid in your stomach, digestive enzymes. They act as physical and chemical barriers, basically keeping these two worlds, these microbial worlds, largely separate.
But here's where it gets really interesting. Despite those barriers, there is significant two-way traffic, surprisingly so. Oral microbes, they routinely make their way down into the alimentary tract. And this absolutely influences your body's health, both physiology and pathology. There are large studies looking at saliva and fecal samples that show healthy intestines can actually be colonized by bacteria that started out in the mouth. This all points to a really central concept we need to explore today: dysbiosis, which is simply an imbalance in these microbial communities.
Okay, so let's connect the dots then. Oral health impacting systemic health. You mentioned the gut connection goes way beyond just, bad breath. The research highlights really strong links between oral diseases, especially periodontitis, that's severe gum disease, and various gastrointestinal problems.
Yeah, and what's striking is looking at the specific microbes involved. Take Porphyromonas gingivalis, P. gingivalis. It's a major cause of chronic gum disease. Well, this specific bacterium has been shown to actually damage the intestinal barrier, make it more permeable, leaky gut, basically. And then it can trigger inflammation down there, too, by ramping up certain inflammatory signals.
Wow, like a little saboteur.
Pretty much. And another one, Streptococcus salivarius, also from the mouth, can impair the lining of the duodenum, the first part of the small intestine.
Okay, this is getting serious. So there's even compelling evidence that long-term gum disease, periodontitis, can directly contribute to inflammatory bowel disease, IBD. You mean oral bacteria literally traveling down and setting up shop in the gut.
That's what the evidence suggests, yeah. And in people with IBD, their oral microbiota often looks different. It's perturbed. You see increases in certain bacteria like Prevotella and Veillonella, which are more typically found in the mouth.
So how do they get there?
Good question. There seem to be two main routes, two highways, if you like. The first one is maybe the most surprising: the bloodstream, the hematogenous route. Periodontal bacteria can actually slip into your bloodstream just from everyday things like brushing your teeth or dental procedures.
Just from brushing.
Yeah. And this pathway is really highlighted by a bacterium called Fusobacterium nucleatum. It's found in the mouth, linked to gum disease. And this same bacterium has been strongly linked to colorectal cancer.
Wait, linked how? Does it just show up there, or?
It gets worse. F. nucleatum doesn't just show up. The research suggests it actually promotes tumor growth. And its presence is associated with a poor prognosis, even treatment failure.
Yeah.
It's quite alarming.
That is alarming. Okay, what's the second pathway?
The second route is simpler, just swallowing. You swallow oral microbes constantly throughout the day, And these can then colonize your gut, especially if your gut barrier is already compromised. Maybe by common medications like proton pump inhibitors, PPIs, or antibiotics.
Okay, that makes sense.
And here's another twist involving your immune system. Certain immune cells, called Th17 cells, they get primed in the mouth, they learn their job there, but then they can actually migrate down to the gut and end up aggravating inflammation there.
So it's not always about the bacteria themselves setting up colony.
Exactly. That's a crucial point. Direct colonization isn't always necessary for there to be an impact. Simply having that imbalance in your oral microbiota, the dysbiosis we mentioned, can significantly affect your gut health. This can happen through things like bacterial biofilms in the mouth, or even just environmental factors tied to your oral health, poor hygiene, diet, certain medications, your saliva quality, even things like mouth breathing. And this oral dysbiosis isn't just linked to gut problems. It's also connected to wider systemic diseases like rheumatoid arthritis, liver cirrhosis, and, as we mentioned, colon cancer. Oh, and another thing, harmful oral bacteria can even mess with your gut through the nitric oxide pathway. This can potentially alter how your colon moves, leading to issues like constipation.
Wow. Okay, so mouth, gut. What about the brain connection? You mentioned neurological and mental health implications, like Alzheimer's disease, for instance.
Yes, absolutely. The oral microbiota in people with AD often looks severely perturbed, very unbalanced. And what's truly unsettling is that P. gingivalis, that same gum disease bug and its inflammatory byproducts, like lipopolysaccharide or LPS, they've actually been found directly in the brains and the cerebrospinal fluid of AD patients.
In the brain.
In the brain. And in mouse models, when they induced periodontitis, the related oral bacteria like F. nucleatum and P. gingivalis led to cognitive impairment. They saw increased buildup of amyloid beta, which is a hallmark of Alzheimer's, and widespread neuroinflammation.
That's deeply concerning.
Yeah.
Especially if these bacteria are common.
Well, and here's the kicker. P. gingivalis is found in about 25% of otherwise healthy people, a quarter of us. And it can get into the bloodstream, potentially reach the brain during dental work, or even just vigorous toothbrushing.
So what can be done?
There is some promising work. Preclinical trials are using specific inhibitors, KGP inhibitors, to try and reduce P. gingivalis infection in the brain. And these have shown some potential in slowing down or maybe even improving AD-related changes. It's a very active area of research right now.
Okay. What about other neurological conditions, like Parkinson's disease?
Yes, recent work has started uncovering distinct changes in the oral microbiota in people with Parkinson's disease, or PD. And get this, patients who have periodontitis, gum disease, have a significantly higher risk of developing Parkinson's later on. Plus, P. gingivalis has also been found in the blood of PD patients. And it's not just about the microbes. Even things like tooth loss and difficulty chewing show a significant link with cognitive impairment in older adults.
Which sort of begs the question, does this extend to mental health too? Psychological conditions?
It seems so, yeah. Systematic reviews are showing a higher incidence of oral diseases. Things like tooth loss, cavities in people with psychological and mental health conditions. And this could be a two-way street, right?
How so?
Well, sometimes poor oral health might result from neglect due to impaired cognition or mental health struggles, or it could be side effects like dry mouth from psychotropic medications. But conversely, cognitive decline itself seems associated with measurable changes in the oral microbiota. Tooth loss, for example, has been linked to depressive symptoms, anxiety, stress disorders, even schizophrenia.
That's quite a list. Are there specific bacteria involved here too?
Yes, there are. For instance, the bacteria coating the tongue can look different in people with schizophrenia. You might see more streptococcus and fusobacterium. Differences are also seen in people with chronic insomnia. There's even a suggestion that changes in how the mouth metabolizes things might show up before schizophrenia actually develops. And in conditions like depression and bipolar disorder, specific types of oral bacteria, things like Neisseria, Prevotella nigrescens, Aggregatibacter, Actinomycetum comitans, Treponema denticola, P. gingivalis, again, their levels have been linked to how severe the symptoms are.
So the patterns, they seem similar across different conditions.
That's what's really fascinating. The patterns of oral dysbiosis we see in mental health conditions often share similarities with those found in systemic diseases, like the gut issues we discussed. This suggests these imbalances in the mouth might be directly influencing changes in the gut microbiota. And that, in turn, could be contributing to those low-grade, subclinical inflammatory changes throughout the body that often accompany mental health conditions and poorer overall health.
Okay, this is a lot to take in. So what does it all mean for you listening? What can people actually do about this?
Well, the good news is there are things you can do, and diet is a huge one. It's a key modulator. The research is pretty clear on foods to limit. Diets high in refined carbohydrates or added sugars. They're strongly associated with gum disease.
Because they feed the bad bacteria.
Exactly. They feed the acid-producing bacteria in your mouth, like actinomyces and certain streptococcus species that cause cavities. And beyond the mouth, these diets contribute to systemic inflammation throughout your body.
Okay, so limit the sugar and refined carbs. What should we eat more of?
Beneficial dietary patterns are generally rich in fiber, whole grains, healthy fats, specifically polyunsaturated fatty acids or PUFAs, and antioxidants. These are all great for oral health. Think about diets like the DHH diet or the Mediterranean diet. They emphasize whole foods, lean protein, lots of fruits and vegetables, healthy fats, and these patterns are associated with lower odds of having periodontitis.
What about plant-based diets? Vegetarian, vegan?
Also linked to reduced risk of gum disease, likely because they're high in fiber and tend to be lower in pro-inflammatory fats. There's a small caveat, though, you need to be mindful. Sometimes these diets can potentially increase the risk for dental erosion or cavities if you're not getting enough calcium or B12, or if saliva pH changes unfavorably. So balance is key.
Okay. Are there specific functional foods or supplements that show promise?
There are a few highlighted in the review. Mangosteen, for example. Regular consumption might be a useful adjunct for periodontitis because of its antioxidants, called xanthones. Supplements like vitamin D, omega-3 fatty acids, those PUFAs again, and polyphenols show promise too.
Polyphenols?
Yeah.
Like in green tea?
Exactly. Green tea, curcumin from turmeric. These could be helpful supporting therapies for gum disease. And here's a surprising one. Fermented lingonberry juice, used as a mouthwash.
Lingonberry juice? Serious?
One study showed it reduced decayed tooth surfaces, bleeding, plaque, and it actually increased beneficial lactobacilli while reducing oral pathogens.
Huh. Interesting. Now, you mentioned fermentable carbohydrates earlier being a bit of a double-edged sword.
Yeah. Right. Exactly. It's a dietary nuance we need to consider. Certain fermentable carbs like FOS, fructooligosaccharides, they're excellent prebiotics for your gut. They feed beneficial microbes like bifidobacteria and lactobacilli. That's great. But in the mouth, they can also feed harmful bacteria like streptococcus mutans, which is a major player in tooth decay and gum disease.
Ah. So good for the gut, potentially bad for the mouth.
Potentially, yes.
So what's the takeaway there? Avoid them.
Not necessarily avoid, but be mindful. A simple, actionable tip from the review is this. After you eat foods rich in these fermentable carbs, just rinse your mouth thoroughly with plain water. That helps remove the particles and sugars lingering around your teeth.
Simple enough. Okay, what about sugar alcohols like xylitol or artificial sweeteners?
Well, xylitol is often talked about for preventing cavities, right?
Yeah.
But recent reviews actually suggest the evidence for its oral health benefits is surprisingly limited. And what's more, some research hints it might cause potentially concerning shifts in your gut microbiome, so something to be aware of. Other things, like rare sugars, cogibiose for instance, show low cavity-causing potential. But honestly, we need more human studies to really know their full impact.
Got it. Let's talk probiotics. That seems like a natural fit here.
Absolutely. Probiotics are live microorganisms that, when you take enough of them, provide real health benefits. In the mouth, they can help prevent that dysbiosis we keep talking about. They do this by influencing saliva pH, preventing plaque buildup, producing beneficial antioxidant compounds, and even directly competing with and displacing the bad pathogenic bacteria.
And is there good evidence for this?
Yes, quite promising evidence. Clinical trials using probiotic lozenges, for example, have shown they can reduce harmful oral bacteria like S. mutans. They've also shown improvements in the overall microbial balance in the mouth, increased protective immune factors like salivary IgA, and fewer oral infections. But here's what's really fascinating, connecting back to our theme.
Yeah.
These oral probiotics have also been shown to reduce intestinal symptoms, things like constipation, acid reflux, stomach pain.
Wow, so taking a probiotic for your mouth helps your gut too.
It appears so, reinforcing that axis connection. And you can find probiotics in fermented foods, yogurt, kefir, kimchi, sauerkraut, miso, kombucha, or sometimes they're added to foods or available as supplements.
Okay, and what about prebiotics? You mentioned FOS earlier. Are they generally helpful?
Prebiotics are related but different. They're basically food for your good bacteria, substrates that selectively feed your beneficial microbes, stimulating their growth. They're often talked about alongside dietary fiber, and they can definitely be beneficial, maybe as an addition to probiotics. However, we have that same caveat again. Some of these fermentable carbs and resistant starches that are fantastic prebiotics for your gut might, if oral hygiene isn't great, also increase the risk for tooth decay and gum disease in the mouth.
Right. It really drives home the need for good oral hygiene practices alongside diet, doesn't it?
Absolutely. It all works together.
So that brings us to oral care itself, beyond diet. What's the key message there?
Well, the basics are fundamental, of course. Brushing teeth at least twice a day, flossing regularly, maybe using mouthwash, chewing sugar-free gum helps stimulate saliva, which is protective, consuming dairy.
Standard advice?
Standard, but crucial. But here's a critical point the review raises, something you might not think about. Prolonged use of common antimicrobial ingredients found in many mouthwashes and even some toothpastes, things like chlorhexidine, triclosan, titanium oxide,
Yeah.
they can actually negatively affect both your oral and your gut microbiota
Really?
by suppressing beneficial bacteria. They're not selective enough, essentially, so they can lead to dysbiosis in both your mouth and potentially downstream in your gut.
Okay, so even trying to do the right thing with mouthwash could backfire if used too much or if it's the wrong kind.
Potentially, yes. It highlights the need for a really holistic approach. Your oral hygiene practices, they need to be considered right alongside your dietary choices and maybe these emerging microbial interventions like probiotics for truly comprehensive care that supports your whole body, not just your teeth.
Wow, what a deep dive this has been. We've really uncovered how oral health, which I think many people see as pretty isolated, is actually so central. It's part of your entire body's ecosystem, deeply influencing your gut and, amazingly, your brain health. It's so much more than just fresh breath or avoiding cavities, isn't it? It really is a foundational pillar of well-being.
Absolutely. That intricate interplay within the oral gut-brain axis is just...
Well, it's truly fascinating. And seeing how an imbalance in the mouth-oral dysbiosis can ripple outwards and potentially impact everything from IBD to Alzheimer's, even conditions like depression or anxiety. And what's perhaps even more compelling is realizing how much our daily choices, what we eat, how we care for our mouth can either support this delicate balance or hinder it.
Yeah. And yet, as you said, our understanding is still evolving. There's clearly a degree of personalization needed too. Different things will impact different people differently. So, considering these profound connections, these often overlooked links we've explored today, what's the final thought for our listeners? Beyond just the routine brushing and flossing, what steps could you listening take, starting today, to really nurture that delicate balance of your own oral gut-brain axis for healthier aging? Something to chew on, perhaps.